thyroid is not the problem. It's thyroid related, meaning the immune system is attacking the thyroid. That's why the thyroid can't function well, not because there was a problem to begin with the thyroid.
Welcome to Talkin' Shit, the podcast where we get real about the unfiltered truths women face in the quest for perfection. I'm Jana, your host, a dietitian and fellow woman navigating the pressure to have it all together. The perfect body, career, relationships, and making it all look effortless. Who set that standard anyway? Here, we're calling out the diet fads, hustle culture, beauty standards, and everything else that keeps us feeling stuck. But we're not just venting, we're diving into how to break free and rewrite the rules on your terms. So, grab a coffee or a glass of wine and let's talk some shit. Together, we'll uncover how to live a life that's unapologetically yours. This is Talkin' Shit. Let's dive in. All right, welcome everyone back to Talkin' Shit. I am very excited to have Lisa today. She is also a fellow dietitian, and we're going to kind of talk about something that I will say I'm honestly not an expert in, but Lisa is. And so she's going to share a lot about her experience, but also what she sees when she's working with her clients. So Lisa, thank you so much for your time today and welcome into Talkin' Shit.
Thank you for having me. I'm excited. I'm looking forward to our discussion and just kind of being real and transparent with your listeners and your fans. As you mentioned, I'm a fellow dietitian. I've been a dietitian for a little over a decade now. I kind of went through, and if you're a dietitian, they always tell you start in the hospital, right? Get your feet wet there. So I did kind of the hospital route for a very short time. And then I kind of filtered through eating disorder. I also did renal dietetics. I did some private consulting. And then I kind of just landed with private consulting, and that's what I do. I have my own private practice. That's where I have kind of landed. And I did teach at a university also for about 6 years. And so I've kind of looked at a lot of different areas, worked with many different people. And I find now, as I work as an integrative and functional dietitian, we kind of see who's on the outskirts, right? Your non-traditional patient, your patient who's gone to everybody, has all these symptoms, doesn't know what to do, doesn't know how to help themselves. And so that's kind of my area now. I tend to practice from an integrative and functional whole person care. And I absolutely love what I do. Yeah.
Lisa, what does that actually mean? For integrative and functional, I have thoughts in my head of what that means, but what does that really mean when we're looking at an individual?
Yeah, good question. I think sometimes those are used as just buzzwords too, right? Where it's like, I'm an integrative this or a functional this. Realistically, I like to kind of just define it as integrative, meaning we're starting to integrate different therapies. We're also integrating our approach at looking at systems, body systems. And functional also meaning practically looking at something, not just from a conventional lens of here's a symptom, here's the diagnosis, here's a medication, or here's a food to eat, or here's a supplement to take. But really and truly looking at the whole person, looking at all of their symptoms, looking at all the different body processes, and then specifically trying to kind of drill down and do root cause analysis as to what is really causing their symptoms. When I have patients, I kind of like to explain it as, when somebody gets a diagnosis of something. So let's say I have a new patient coming to me because they were diagnosed with type 2 diabetes. Yes, that's their diagnosis, type 2 diabetes. However, from the integrative and functional lens, we don't just look at that as a diagnosis. We also look at that as, okay, that's the symptom of what? What was the problem to begin with? What was the imbalance? What was causing the pancreas maybe to not function effectively or the body not to utilize insulin? So we kind of look at, even diseases, yes, they are diagnoses, but we, in one sense, we look at them more as symptoms. That's the byproduct of what was going on to begin with. So that's kind of how I like to define integrative and functional. We're really looking kind of like peeling an onion, peeling the different layers back to really drill down and find out what are those root causes of these imbalances or inflammation or dysregulation in the body so that we can hopefully resolve it, right? So for example, if somebody was deficient in a nutrient, we can balance that out, and then hopefully we see symptoms go away. For example, like anemia, right? If I was iron deficient and I had anemia, if I replenish with iron, the anemia goes away. So that's how I kind of define integrative and functional. It's really looking at the whole person and all the systems and how they really integrate together versus looking at systems separately, and not really seeing how they all kind of correlate together and how they all affect the one whole person.
Yeah. I love that because I always will share with clients it's all connected. Like there's no
Mhm.
thing that's ever in isolation.
Mhm.
Yeah, it might feel like far-fetched, like particularly when I start talking about sleep. They're like, "Why are you asking me about sleep? I'm
Yeah.
about food?" And I'm like, "I'm going to get there. You're going to see the
Yep.
connection soon because how you sleep definitely impacts how you eat." And so I love that you're taking that approach. One, it's a whole person and the system
Mhm.
functions as a whole. It doesn't function
Mhm.
in isolation. So I love that.
Mhm.
And it really gives a lot of lens because you're looking at the symptoms, not necessarily the lab.
Mhm.
And I know a lot of women have said, like, I went to my doctor and they say, oh, everything looks fine, but I'm still having these symptoms. So it sounds like someone could come to you and be like, okay, here's my labs and things may be normal, but you're really looking at their symptoms,
Mhm.
what needs to be adjusted or what needs to be corrected. Is that accurate?
Oh yeah, absolutely. Just for example, vitamin D. I've had many patients over the years that have, because I always review labs. I'm sure you do too, right? We always look at labs. We want to see kind of what the status of the person biochemically. And vitamin D is one where somebody will come to me and they'll have, let's say, a vitamin D level of 32, right? And the reference range typically is 30 to 100. Well, if you have a vitamin D of 32, that's really not that much different as having a vitamin D of 29, right? At 29, we're insufficient. We don't have enough. At 30, we say you're good. But symptomatically, is 30 really enough for you to feel well, right? Vitamin D is not really a vitamin, it's a hormone. And so, is that enough to really have you feeling well, your mood, joints, bone health, right? A number of things. And so, through the functional lens, instead of getting somebody to 30, we really say, okay, what's the functional level or the optimal level? And we aim to shoot between like 50 to 70. And so, we really want to get somebody at a level that for them, they feel really good. They have a lot of energy, they metabolize well. Weight is not really an issue, assuming they're following a healthy diet and lifestyle pattern. So we don't want to just kind of get somebody to you're okay and you're stable. We really want somebody to be feeling their best as best we can. And yeah, there's in the conventional world, they have a little bit different model. I remember, I forget who said it, but somebody on one of the other with like practitioner podcasts I was listening to, and the guest was saying, we're starting to learn more and more about less and less. And what he was referring to was if we're specializing in only one area, let's say I'm just a cardiologist or I'm an endocrinologist, he said we're starting to just get really funneled down and we're learning more and more, but it's about smaller and smaller areas. And this was a physician, and he said then the byproduct is we lose the whole person care, right? The cardiologist says, well, I don't know, they do a cardiology, so go back to your doctor for a referral to the endocrinologist or go see the pulmonologist. And so he was saying the downside is we've kind of lost that whole person view. And so, like I said, definitely we see people where they've gone to many practitioners, they have all these symptoms, and sometimes I find people don't know where to land, right? The cardiologist, they've gotten cleared by the cardiologist. They say from a cardiac standpoint, you're fine. They go to the pulmonologist. From the pulmonologist standpoint, you're fine, right? They go through the motions and they still end up with, okay, but I still have symptoms. Everybody says I'm fine. My labs are great, but I still have symptoms. And kind of like you brought up with sleep, right? Circadian rhythm has a huge impact on digestion, cell repair, just our normal night day cycle, what hormones are produced. So, yeah, we tend to kind of, I mean, it's not really looking outside the box, but in the conventional model, it's considered looking outside the box at where those imbalances could be coming from.
Well, and that really lends to the idea of lifestyle medicine as well.
Mhm.
we're looking at what does your lifestyle do for your health, essentially. And there's
Mhm.
so many things that impact ultimately how you feel throughout the day. And I'm really particular about asking clients, well, how do you feel? Because oftentimes individuals, one, have never checked in with themselves. So to even be able to capture that, like, oh, I feel good, but is good just your normal and you're used to being exhausted, right? And sometimes the feedback has to be like, that's actually not normal and we want to make some adjustments. So I love that you're checking in with like how do they feel, what those symptoms are, and the whole person approach. But I know that you also kind of specialize in the autoimmune aspect. So tell me a little bit about how that came about.
Yeah, that is it's kind of an area that I sort of fell into intentionally. I myself have an autoimmune disease. It got diagnosed probably later than it should have. I'm one of those cases. I went to the doctor. Was telling about symptoms and I got brushed off. It was after I had delivered my son. So most of the doctors I went to just kind of said, "Oh, this was your first pregnancy. Your body has to go back to normal. Don't worry. This is all, normal." And intuitively, I knew this. I don't think this is normal. This can't be normal. And so intuitively, I knew that I just kind of kept having to break down the door, so to speak. The downside was I didn't have a lot of knowledge as to where should I go, right? I'm used to the traditional medical model. And thankfully, actually at the time, I was an office manager at a dental practice, and the dentist that I worked for, I was kind of explaining some of the symptoms, and she saw me every day, and she goes, you should probably go get your thyroid checked. And so I went back to the doctor and said, okay, I'd like to have a thyroid panel run. And that was where I ended up finding out that I had autoimmune thyroiditis. And so from there, that ultimately, I think, changed the trajectory of kind of how my career and what I was going to do. And so I actually, at the time, I finished my undergrad degree, which was in communications, and then took a break after that and decided I'm going to go back to school and get my master's in nutrition. Um, and so, kind of along the way, I'm working through my own autoimmune disease. And then I'm also, become a dietitian. And then just over the years, the more that I've learned, the more that I work with people, I feel very comfortable working with autoimmune disease patients because I am one, especially autoimmune thyroid patients because that's what I have. So it kind of, again, I kind of fell into it sort of, just because I have an autoimmune disease. But then on top of that, I'm somebody who I'm not okay with just saying, well, you have that. We don't know why. I like the detective work behind it. I really want to solve the problem. I want to find, where the issue became, a problem. And so I've just had people over and over. It's like if they have nowhere to go, they end up, in my office. And yeah, I've had many actually. There's one patient in particular that I had who her background information she sent me was about 55 pages long. And so I reviewed it before I saw her. And she is one who said, I went here, I saw this doctor, I had this test done, these other ones done. I've got like they've all sent me somewhere. And she said, every doctor has said there's nothing wrong with me. It's all in my head. And, and they actually sent her to for some counseling because they were telling her it's just all in her head. So we were doing some things. We got some genetic testing. We weren't seeing as many changes as we would have liked to have seen. So we did some genetic testing on just kind of, hormones and enzymes and detoxification. Through that, we found some SNPs, right? Single nucleotide polymorphism. So essentially some genes that code for enzymes that weren't working as efficiently as the, other gene. Made some changes. From there, she ended up going to get some formal genetic testing for actual condition. And come to find out, she ended up finding that she had a muscular dystrophy. So she had been diagnosed with fibromyalgia but also said, well, that's what we're going to give you, but it's really in your head. It's not really a diagnosis for you. Only to find out that muscle pain and fatigue and weakness was really caused by the muscular dystrophy issue, but nobody ever took her seriously and really pushed to kind of, again, try and get to that root cause problem. So she was one of my most complex cases for sure, just in the degree of symptoms she had, the severity of the symptoms she had, and not as much response to treatment. But again, we ended up finding out that she wasn't responding as well because genetically there was only so much we could do. But yeah, like I said, very, very common. And so my heart really goes out to those who just feel like they're lost. They've been trying to find out the answer. They feel like they keep hitting a door, or a wall and can't get through it. So yeah, that just tends to be the people that I see.
Yeah. And I thought it was interesting. So you shared before we started recording that autoimmune diseases are increasing anywhere from 3 to 12% every year. That's big.
Mm-hmm.
What do you think is contributing to that?
So I can give you kind of what research has shown and also just what I just over the years working with people and making changes in how we see improvement, what I kind of relate it to. But one of the things that we know with an autoimmune disease, right, all that means is the person's natural immune system is essentially attacking its own tissue, right? Auto meaning self and immune, your immune system. So the immune system is essentially attacking itself. So it could be, thyroid, it could be joints, it could be right, pancreas, whatever it is, the immune system is attacking itself. There's kind of a line of thinking that says that it could be a hygiene hypothesis, meaning over the years we have become more clean and sterile as a culture, as a people. And it was kind of funny. One of the studies said, well, the immune system didn't have much to do. It wasn't fighting germs really as much anymore. And so it started attacking itself. Now, does it truly just say, well, there's no germ to fight? No. But if we look at the microbiome or just kind of the overall, microflora that is in and on our skin, right? We don't want to disrupt that. That is a good part of how our immune system works. In the GI tract, we have the GALT tissue, right? The gut-associated lymphoid tissue. So in that sense, it does make sense where if we start becoming more clean, so to speak, or sterilized, like think of the antibiotic soaps, right? Antibacterial soaps, things like that, bleach, things like that. If we do disrupt that, yes, we can then alter immune systems. So that's one theory. Other data shows, even though genetics haven't really changed that much over, let's say, 70 to 100 years, our environment has drastically changed. So foods, how they're grown, how they're raised, industrialized food for sure was a big change to our kind of just overall, culture and environment. More manufactured foods, more processed, refined foods, things with chemicals or food additives, right? So all of these things that we either have going into our body or going on our body or around our body, right? Our body's communicating. Our immune system is communicating with these things. So that's some of just kind of the data that they look at. It's like, again, environment, pollutants, even changes just to genetics. So something that can cause our own genetics to change. And then the system goes haywire. So all of these things, they do think play a role. Is it just one? Probably not. It's probably, a myriad. For one person, it might be heavily that it was some sort of, environmental toxin. For somebody else, it could have been coming from, food that they ate. I will tell you that in working with people, I have seen those who have a very high intake of processed, packaged, fast foods, convenience foods. We tend to see more IBS. We tend to see autoimmune issues, definitely the dysbiosis. So clinically, when I look at it just with what I've experienced working with different patients, I definitely think, again, our environmental changes, whether that's, again, food, chemicals, toxins, I definitely think those are heavily playing a role. All right, I'm sure you've heard of endocrine disruptors, right? Things that are found even in products that in laundry detergent and soaps and makeups, right? I mean, our skin is the biggest organ and it's right? It allows, it permits things to go through them. So I would venture to say that it probably is a combination of, again, kind of that microbiome. I don't know if you ever heard, there was a study that was done, and then the article that came out said, let the kids eat dirt. And they were looking at the microbiome, and they said kids that grow up on farms or with animals or they're playing in the dirt have much lower occurrences of chronic diseases and autoimmune diseases. And they were tying it back to their immune system was more robust because of the, essentially pathogens and the microbes and stuff that they had in interaction with growing up that just improved their overall immune system. So I think, again, I think it's multifactorial. I don't think it's just any one thing. I think it's a component of your natural genetics and then what things most heavily influence your own genetics. And again, it may be different person to person. One may have more of an influence from foods. Somebody else may have more of an influence from environmental toxins. But we definitely see all of those do likely play a role. Yeah.
So where would you suggest, like if someone is listening to this and they're concerned that they do have an autoimmune disease or they've been diagnosed with one and they feel like they are not receiving the care that they need, how would you direct them, or where would you say they need to start, really, or continue maybe?
Yeah. Good question. So that's a hard one as far as it kind of depends on where you are. Do you live somewhere where you have access to a wide variety of different medical professionals? Or do you live somewhere that's maybe more rural and you don't have access and you'd have to travel? There are definitely a functional medicine practitioner or an integrative and functional practitioner would be maybe a place to start, only because they are geared towards looking at the whole person. They're not just symptom-based or, medicine-based. So that'd be number one. Number two, I always encourage people to keep track, if they can, of their symptoms, what they're feeling, how long, how often. I have found when some of my patients have gone to providers and they just say, I'm feeling like this. Well, how long? Well, roughly about this long. When does it occur? I can't really tell you. But if they can go in and go, okay, I've been experiencing this symptom since, January 3rd. I've noticed that every time I eat this thing, it occurs, right? If you have more just quantitative data, I have found that doctors tend to be a little more receptive, even if they're not in the functional realm. And then I always encourage people to be your own advocate for sure. So if you really feel like something is going on and you really want some further testing, I'm an advocate for telling your doctor, hey, I'd like this test run. So for autoimmune diseases, one of the things that I'll usually have people run just as kind of a baseline is an ANA, so anti-nuclear antibodies. That's kind of just a generic, is there any sort of autoantibodies to the person, in their own immune system? And it'll result as either a positive or a negative. If it's positive, then we go to step 2, which is now we run the whole panel, right? So we look at the whole autoimmune panel. Is it Sjogren's? Is it scleroderma? Is it rheumatoid arthritis? Is it lupus? Is it autoimmune thyroiditis? So that's one. I've had some patients say, well, my doctor didn't want to run an ANA. And I'm like, you go tell them that you want it, assuming you're willing to pay out of pocket if you have to, right? But tell them that you want to run the ANA. So that would be another key point, would just be, just be your own advocate. You really have to advocate for yourself. I tell people, nobody knows you better than you know you, right? You're the only one that feels your symptoms. You're the only one that is with yourself all the time. And so it's hard sometimes to communicate that to a provider, to really tell them, right? What are you feeling? And women, I think too, in just my experience, women tend to carry a lot, right? And if they're moms or they're working, we tend to put ourselves last. So it's like everything else kind of takes priority. And so I always encourage people, it's kind of like the plane thing, right? They tell you put your own mask on before you help anybody else. So I like to tell my patients and people that I kind of come across with, it's like, especially if you're a mom or somebody who's, working and busy, you have to put yourself first. Otherwise, how do you help other people? How are you going to show up for other people when you're not feeling your best. So that I think is a key thing where we really have to do that self-care and take the time and put in the effort to make sure we are taking care of ourselves. And then aside from that, there are a lot of functional, platforms out there, the integrative and functional medicine community, integrative and functional nutrition academy. There's a lot of different platforms you can go to kind of, get further information. And so that's another area that I do recommend is just kind of, do an internet search, try and find the credible, associations or again, companies or platforms that really can help the trajectory. There are quite a few labs, so you can actually order labs on your own. Vibrant Health, Rupa Labs, so there are companies where you can order labs that you want to have tested on yourself, stool samples, tox screens, things like that. So I always like to try and empower people where I don't want somebody to feel like, they just have to wait for their doctor to do something or they can't. I always tell people, you're paying your doctor, right? They really work for you. When my patients come to me, that's what I tell them. You're paying me to help you, so I work for you. So, that's how I want them to see their providers, that I don't want them to feel powerless. I want them to feel like, they can take control of their health and kind of, maneuver through a little more smoothly.
Yeah, I think that's so important, is to go into your doctor's visit prepared, because nerves really are a thing. A white coat, and you're like, oh shoot, what was I going to ask, or what was I going to say, or whatnot. Highly encouraged to even, individuals will use me to kind of talk through different things that they should ask their provider, and come up with questions. They write it down, they take it into their doctor, and usually the doctor's like, this person's involved in their own health. And it usually is received pretty differently versus, well, I don't know, you tell me, right? So just again, stepping into that empowerment aspect of you do know your body, and we want to be able to convey and communicate that. Otherwise, from a provider's lens, we aren't able to do much, right? We need that information from you in order to kind of put the pieces together. And so that can be so helpful, and also just to calm those nerves too, because you're gonna, be able to go through those questions. So that's so helpful.
And how many times we walk away from something going, dang it, I meant to ask about X, Y, Z, and I forgot. I go to the grocery store. Shoot, I forgot to put that thing on my list, and then I didn't remember. But yeah, definitely going in well prepared, especially because depending on your provider, and you may have 10 or 15 minutes with them. Right? You don't want to be spending time going, okay, hold on a second. I know that there was something I was going to ask. Let me try and recall it. But you can go, okay, question number 1, what tests can we run? Question number 2, why am I having these symptoms? Right? That kind of helps to streamline. And like you said, as a provider, that helps us. I always feel like I'm, it's like the little magic trick where you're pulling out the little, handkerchief, and it just keeps, I'm trying to constantly get information, right? Because I don't know, I don't live with them. I'm not them. I'm not in their head. I'm not in their body. And so the more you can really give to the provider is much more helpful, in that we're kind of able to now start to categorize or I don't know how you are with patients, but when I'm doing in my initial assessment, especially, I feel like my brain's going to put a peg in that, put a pin in that. Okay, that's related. Remember this. Make note of that, because again, things are related. And so, the more information somebody can provide, then I feel like the better equipped you are to maybe try and at least get some better care, because you have more information and evidence to say, okay, this is what I have. So where can we go from here? So that's a really good piece of information would be be really, really prepared when you go into your provider.
Yeah. Well, so I'd love to talk about food, because we are experts in similar to you, Lisa. I became a dietitian because I had a lot of gut issues. There was a lot of different things. I was restricting food because my stomach was hurting, and then I had lactose intolerance, and just all these things. And my my GI doctor at the time, he said, well, just change your diet, you'll be fine. That was the level of education. And I was like, what does that even mean? So I mean, I am a curious person by nature. And so I started Googling all the stuff, and started finding out all of this information around nutrition. And I just became fascinated with it. And the more I made changes to my nutrition, the more I felt just so much better. And so that was really fascinating to me. And I always think about that when I'm working with my clients, especially if they're not feeling well. It's like, how can we really support them from that lens of food is medicine?
Mhm.
Support. I mean, it's not gonna do everything, right? Like I always
Right.
it's only part of the equation. It's not the entirety of the equation, but
Right.
it's part of the equation. And so we want to support you in making sure that we are nourishing and fueling your body, so that it feels its best. So from that food lens, what is kind of like those first steps then if someone is looking at autoimmune or even like you mentioned earlier, like type 2 diabetes?
Mhm.
What do you typically like recommend? I know this is very general information.
Broad, yeah. Mhm.
Yeah, but what does that look like?
So first, I always try and assess kind of where the patient is at to begin with, and what is their level of readiness to make changes, right? We could come in and say, okay, pull out these foods and add in these ones, right? But if somebody's not ready or willing to make changes, then what we say really doesn't matter. And so typically when somebody is coming in, if the I would say the more symptomatic they are or the worse they feel, probably the more likely they are to really want to make some changes because they don't want to feel, bad anymore, right? So again, I kind of look at where they're at and what is their level of readiness for change. That's number one. And then as far as autoimmune specifically, so there are some autoimmune protocols where we really start pulling out a number of foods. We know that some are inflammatory just kind of by nature. So dairy is one, gluten is one, right? Seafood can be a problem, right? Think of the traditional allergenic foods. Soy and gluten and dairy are probably the top three when we're looking at autoimmune diseases. Now, I say that, and it doesn't mean if you eat these foods, you're going to have an allergy and get an autoimmune disease, right? What we look at is, okay, out of the people with an autoimmune disease, what percentage of them also have an allergy to these foods? So again, when we're talking immune system, there's this correlation to it. Same thing as vitamin D. Low vitamin D is correlated with autoimmune disease. It doesn't mean if you have a low vitamin D, you're going to get an autoimmune disease, right? But it means that if we test everybody who has an autoimmune disease, how many of them have a low vitamin D, and there's a high correlation. So with that in mind, there are some things that we kind of know work really well. Number one would be inflammatory foods. So we want to pull out inflammatory foods as much as possible. So think processed, refined, ultra refined, right? Somebody who, let's say, this has actually been a breakfast. I've heard this for breakfast, Snickers and Coke. Okay, that would not be an ideal. That's very inflammatory, right? Lunch may have been pizza and potato chips and a soda. Dinner might be, going out to get fast food or, something made at home, but from a box or a can. I've worked with people and almost nothing in their entire day was actually grown or raised, right? So no produce or no, chicken or beef, things like that. So that's one area where we know that there's a lot of, benefit and improvement in symptoms if we just can pull out those inflammatory foods. One of the first steps I usually tell people, I don't know how your patients are, but if we just come in and say, pull all these out, they're kind of like, what? No, that's how I've been eating for so long, right? And so instead of just coming in as like the food Nazi going, I'm the food police, you're not eating these. Instead, I really try and substitute. So I start saying like, okay, what can we bring more of into the diet, right? Because I'm hoping that we'll displace some of those foods that are less healthy. And I have kind of a 3, guideline that I follow, and it's frequency, nutritional, like makeup, and then quantity. So what's the frequency that I'm eating something? What's the nutritional makeup? How nutritionally dense or nutritionally void is it? And how much at a time am I eating that food? So for example, potato chips. How often am I eating it? what's the nutritional content of that food, and how much am I eating when I'm eating it. So that's kind of my just simple, tip for people to work with. We want to eat nutrient dense foods more frequently, right? We're obviously there are nutrient dense, that's the goal. And then the proportion of those foods needs to be higher in the diet. So that's one of the tips that I try and give people, where I'm not necessarily telling them what to eat or not to eat. Instead, I'm saying, look for the nutritionally dense foods the majority of the time. And so that's another tip. So I would say my top things for autoimmune specifically would be pulling out the inflammatory foods, utilizing foods, especially all the vibrant colors and different produce, right? All the different phytonutrients really help support either the immune system or detoxification. And so I really want to go with eating a lot of colors, eating fresh, eating whole. And I've had patients where, especially with thyroid, sometimes we can use some selenium to kind of help protect the thyroid itself, the thyroid gland and tissue. Maybe they don't really eat much selenium. They don't take a multivitamin. So they really weren't getting even the recommended daily amount of selenium. And just by adding in some selenium, we were able to help. So I would say those are probably kind of the biggest things. It's really pulling out those inflammatory foods, adding in your whole, your fresh, unprocessed, eating a lot of colors. And then the other thing I always like to tell people is cultured. Many people do not get enough probiotics, right? Again, kind of going back to that study on the dirt, they were saying that it really boosted the GI tract because if you have, an intake, not intentionally, not people should eat dirt, but dirty hands and you ate your lunch. Yeah. What are you eating today? A nice bowl of dirt. Yeah. But you're right, dirty hands from working in the garden, right? And you ate an apple that you didn't wash all the dirt off your hands, or just breathing it in. And so you're getting an exposure to different microbes, which again, boost the microbiome. Also think about cultured foods, right? Fermented, how much kimchi, how much kombucha, yogurt, kefir, sourdough, right? How many cultured foods are people getting, right? And again, when we do a diet recall, yeah, not very much. A probiotic, I would say, I kind of joke with my husband. He's always like, you should be on MyPlay's, payroll, because it's just a product that it's easy over the counter, not super costly, has 12 different strains of probiotics, right? So it's kind of something where we can meet the average person's probiotic need with this simple thing. And so that's one place I'll start. There are people that literally, they don't do yogurt, so they never really get fermented foods. And again, right? Prebiotics is the food for the probiotics, which are those bacteria, which then need to go in the gut. And then they make postbiotics, which are neurotransmitters, vitamins, things like that. So it's kind of like a 3 Ps. So probiotics and cultured foods definitely are another key thing when we're looking at immune health, because again, we really want to strengthen that microbiome, because depending on studies you read, some studies will say 60% of your immune system. Some studies go up to as high as saying it's 80% of your immune system. At the end of the day, we just know that they're important, right? Whatever to 60 to 80, whatever it is, we know they're important. And so that's kind of a really key thing when we're looking at immunity is, what does the microbiome look like? Yeah.
Yeah, it's interesting. I like to recommend the pre and probiotics for those that get sick often versus vitamin C. Like a lot of people say, oh, I started taking extra vitamin C. And I actually don't really I don't prefer that. You probably just pee it out in all of
expensive urine.
Yes, but the pre and probiotics, they have done wonders for myself included. And just when they're able to implement those in, so much less gas, bloating, illness, like they really are so pivotal in the diet.
I have a funny story. When I used to work at a renal clinic, there was a patient that had come in. So these were dialysis patients. And I worked with peritoneal dialysis patients, but new patient comes in and didn't have an IBS diagnosis, but had this severe rebounding constipation, diarrhea, back and forth, could never have normal bowel movements. Stool was not regular. Consistency wasn't regular. Frequency wasn't regular. And when he presented, he actually had said, my doctor had been polystyrene and I had tried this and I've tried nothing seems to work, right? And so, of course, I'm like, here, let's try this probiotic. It's over the counter. You can drink it. You can add it into oatmeal or yogurt or whatever. And month 3, because we only saw our patients once a month, they'd come in unless they needed something, additional. Month 3, he comes in, he's like, I'm normal now. He's like, I finally have like regular bowel movement. And he was so thrilled. So then it was so funny because then that particular doctor, every patient who happened, he's like, should we do the probiotic again? Do you think we should try this one? Because even the doctor really had no, and granted, right here again, renal was his scope of practice, not GI, not nutrition. But he even was like, okay, and he's kind of skeptical to begin with. He probably thought I was one of these like woo-woo dietitians, okay, just try the probiotic. And literally by month 3, he's like, okay, it actually does really work to improve the GI health and improve stool, And so, yes, like you said, I mean, yes, vitamins do help. But if we do not have a good GI tract as far as that microbiome goes, it doesn't matter what you're putting in. You're probably not going to utilize it very well. You're not going to be producing the things you need to. And there's also the gut-brain connection. And this is a very fascinating aspect to look at as far as the body. And here's another way. It's like, it's not just the GI tract, right? Our systems are integrated. So what goes on kind of in our psyche affects the microbiome. What goes out of the microbiome can affect how our mood and our psyche is. And one of the ways that I like to just kind of translate this to people so they understand, I will always ask them, have you ever experienced butterflies in the stomach? And most people are like, yeah, I have. I've had that experience. And I'm like, okay, well, how did it start up here? And you were thinking about going to this place or seeing this person or excited about this event. That all started up here. So how did you feel it in your gut? And they're kind of like, that's a good point, right? That's because it's integrated. It's all integrated. And so, yeah, so we have to make sure we do look at the whole person. So even with the microbiome, right, because it's bidirectional, I may have a poor diet. My microbiome is terrible and I'm not producing enough vitamins. I'm not producing enough neurotransmitters. And maybe I have mood issues and I'm depressed all the time, right? So yeah, we really need to make sure when we're looking at diet, we are definitely making sure that somebody has enough of the cultured fermented foods, those pre and probiotics. Yeah.
Yeah, it's interesting. I see that a lot with, I'm a certified diabetes educator as well. So I see that with, particularly my type 2 diabetics, they have a very high risk of anxiety and depression, but also the gut health aspect. When we start to focus in on that, we start to see less anxiety, less lower blood sugar numbers. I mean, really, it is the center of where everything. So it's fascinating. And that's the stuff that I really love because that's where the empowerment comes from, because that's things that individuals can do that really impact their health. It doesn't require a healthcare professional, right? Like, these are things in their home that really set their health up for success, and so key.
No, I agree with you on that 100%. That's one of my passions, is to really educate. I always tell my patients, I'm like, look, I hope to be out of a job at some point. Like, I'm the training wheels, right? I'm the training wheels on the bike, and you shouldn't need the training wheels forever. Like, at some point, you got to lose the training wheels. But I do think we live in an environment where, it's really not healthcare. It's more of just sick care, right? Where we see all these chronic conditions and people are just getting a medication, or they're getting, this test run, but no, I mean, how many physicians will sit down with somebody, number one, for more than like 15 minutes. And number two, really look at their whole life. What are all the different lifestyle, patterns they have? What are their dietary patterns that they have? I mean, in my experience working with providers, so I had one, she's a really good provider, very well credentialed, but I had to go toe to toe with her because she kept saying, well, some for my thyroid. She's like, your TSH is overly suppressed. You need less medication. And I'm like, but if you look at the T3 and T4, there's not enough. I'm like, so clearly you can see that TSH itself is not a very good marker for me of how well my thyroid is functioning. And then she didn't want to do anything. I ended up actually pulling some studies. I was a dietitian by this point, pulling some studies and sending some studies referencing for autoimmune patients how the TSH does not respond in the normal way for every autoimmune disease patient. Because again, the problem is not thyroid related. Thyroid is not the problem. It's thyroid related, meaning the immune system is attacking the thyroid. That's why the thyroid can't function well, not because there was a problem to begin with the thyroid. And so for many people, I feel like, we really need to make sure that, again, we're kind of like covering all aspects of things, but then also, again, kind of really digging deep and not just looking at, well, this is your symptom and this is what my protocol says. If you have this, biochemical marker, this is what we do. They really need to be listening to the patient, and not just, well, this is what we do for that. So I can't help you any further. Yeah.
Yeah. And I mean, also, this is where I'm encouraging, like, refer out to a dietitian. Like, doctors aren't going to know everything. That's not that. And, and I don't want, like, I want to create where we are saying, like, we're part of the team, because we are, and we typically are underutilized. And this is where we can be the advocate for the patient, but also be the advocate for the doctor and be part of that team approach so that we can enhance healthcare, not just write another prescription.
Oh, and that's a really good point. So I was going to say, I had one patient who, here again, kind of a slightly elevated TSH. She had come to me as a referral from somebody else who had come to me, and no ANA was positive. So she still was kind of below the threshold, right? So no ANA was positive, but she had this kind of elevating TSH. Her autoantibodies were tested and they were very low. She had some, but they were pretty low. And so her doctor's answer was just, we're just going to watch it. We'll just see what happens. But that was it. They didn't try anything, we'll just watch it. And so that's why she kind of sought out some additional help. So we made some dietary changes. We started the selenium. By 6 months later, TSH is back in range. She's not going to have to worry about, and it had been just steadily climbing apparently for the previous year and a half. Well, then we finally get it to go the other direction. TSH is coming back down. Things have normalized. But you look at and she even asked me, she goes, so my doctor would have just waited for what? And it's like, maybe just until you were positive for an autoimmune disease, right? And then you would have gotten a medication. Yeah. So it's definitely something where we really want to empower those people, and for providers, utilize us, right? We have a very unique skill set in that, like we're talking earlier, right? We don't just create meal plans for people. That's not what we do, which is funny too, because when I've had some that come to me, they're like, I just want a meal plan. I always tell them, are you going to follow the 6 to 8 week meal plan for the rest of your life and just rotate it? Well, no. Okay, so let me teach you how to eat well, right? So that you can be in control of that. But I think a lot of people just think, oh, a dietitian, it's either they think they're the food police and they're going to take away all the foods that I want to eat, or it's, go to them for a meal plan and that's it. So yeah, I definitely think we are very much underutilized. And I think too, really is just kind of our profession. It would be nice to just get more credibility for what we do, because, in many regards, we should be seen as equals to the doctor, in that the doctor has a set of skills and credentials for what they're doing, and we equally have a set of skills and are credentialed for what we're doing. So it's not really neither one really has more value than the other one, right? We really both have equal value. It's just how are we best utilized to help that patient and do patient care?
Yeah, because how many years of schooling did you have specifically on food? I mean, I think I'm at 13 years now. I don't know what, but post credentials or whatnot. Its focus is how food impacts the body, and it really does impact the body in so many ways that I think we know, but sometimes we have a hard time applying that.
Mm-hmm. And that's one of the things I ask people, especially if they take a medication, right? To kind of get them thinking, is food really effective? I always like to ask people, are you allowed to take grapefruit with your medication? Oh, no, I can't take grapefruit. They specifically said no grapefruit. Well, if food doesn't do anything, why can't you just go eat grapefruit, right? And that's where it's oh, yes, because foods have compounds in them that have an effect on the body, right? That can help or hinder something. And so, yeah, I do think that people kind of, and even when I was in school, right, we actually, as the dietetic department, actually put together some curriculum and did some for because there was also, it was a health school, so there was also doctors, programs there. And we had to put together information so that they could have some nutrition education. And it's just like, but then the doctor's going to go give people, right, dietary education as a practicing physician, and they had like a day or two of nutrition education. So that would be like me saying, oh, I had a lecture on, cardiology. And so I'll just come to me for your cardiac needs.
Well, Lisa, I love this conversation. I'm going to steal that example that you give for the butterfly analogy.
Really?
Great one. But I think this was, I'm fascinated. I said before we started recording, autoimmune is not in my expertise. I'm more, well-being and also diabetes. But it's so fascinating from the gut lens because I think that's where it crosses over quite a bit. And I think gave so much good information to those that are listening to where they can start and then also really be their own advocate for wherever they are in the landscape of healthcare that they find themselves. So I so appreciate your expertise and thank you for your time today.
Yeah, thank you for having me on. I really appreciate it and love the conversation.